Okay, shall we make a start?
Okay.
So, welcome everybody to the Centre for Professional Development and Lifelong Learning. We'd like to tell you a little bit about the Centre, how we deliver our courses and how we can help you. And if you're tweeting about us, please do use our hashtag CPD4ALL, and our Twitter name is @CPD4ALL. So please, we would encourage you to tweet about us, especially during this webinar. So who are we? You'll see 5 members of the team using our webcams up there, so you can see us. I'm Lizzie Mills. I'm the Director of Postgraduate Studies at the Centre. And Alison, would you like to introduce yourself?
I'm Alison Gifford, and I am the Programme Manager for the Advanced or the APP programme, and also for the DPharm.
Thank you, Alison. Jackie.
Hello everyone, my name is Jackie Kinsey. I'm a Senior Teaching Fellow within the Centre for Professional Development. I'm the Programme Manager for the Prescribing Studies programme, and that also includes our independent prescribing course for pharmacists.
Thank you, Jackie. Daxa.
Hi, I'm Daxa Knowles, and I'm the Course Manager for the Clinical Diploma for Hospital Pharmacists.
Thank you. And Sharon.
Hello, I'm Sharon Warren, and I'm the Community Pharmacy Programme Manager.
Thank you. So the people you see here are some of the team. There are people who were not able to join us today. It's Wendy Clark, who manages our MSc programme. Pat Black, who is the professorial lead for the centre. Bob Saunders, who is our teaching fellow and works on the Prescribing Studies programme and independent prescribing, and he'll be running a webinar next week on the 13th of May. And we have Karen Gunnell as well, who is part of the centre. We also have administrative staff, Bev, Linda and Amanda, and a fantastic IT team as well, who are all part of the centre. And if I've forgotten anyone, I apologise. So, who are we and what do we do? So, the Centre for Professional Development and Lifelong Learning was originally established in 1994 as a department within Keele University. And we had the unique mission to provide postgraduate education for pharmacists and other health professionals whose role is central to the prescribing and use of medicines. And over the last 20 years, we've built strong links with the NHS and with employers. And we now have a national and international reputation for delivering postgraduate education, primarily through work-based and distance learning. In 2005, the School of Pharmacy was established and we became a centre of excellence within the school. And our growing reputation has led now to the formal development of the centre and the launch of the Centre for Professional Development and Lifelong Learning, or CPD4ALL. So, what can we offer you and what makes us unique? Why? So all of our courses are provided through distance learning. We've built our reputation on the provision of distance learning courses that support your professional development. And this means that you can be flexible in terms of where you study and when you study. We also provide flexibility in what you study and how you choose to approach the course. You can choose to register for a certificate or a diploma award from the outset, or you can choose to register one module at a time and build up credits towards an award. But of course, you don't have to study towards an award. You can just choose to study one module if that meets your own professional learning development needs. All our modules are designed for practicing health professionals and are designed to encourage you to put your learning into practice and to reflect on your development. And we do this through the use of learning activities within the modules, such as practice spotlights and work-related assessments and projects. You'll also be asked to keep a reflective portfolio for most of our courses, and this is where you can really demonstrate and reflect on your developments. We have a dedicated postgraduate team with extensive expertise in supporting distance learners. The postgraduate team includes administrative and IT support as well as academic support. We'll provide you with written materials and podcasts to get you started, a dedicated induction programme, guides to the IT systems that you would need to use, and dedicated IT support. And we are always at the end of a phone and responsive to emails. Once you get started, we provide you with detailed feedback on your assessments to help you to develop. And we receive many comments, both from students and external examiners, about the level of support that we provide our students. For example, this from an external examiner: I'm particularly impressed by how caring the course team are towards the students and by the thoughtful way in which student support is approached. And there are a few other comments there from students about the support. So thank you for your enthusiasm and support last year, and congratulations on creating such a user-friendly and relevant diploma syllabus. Without your constant advice and follow-up, I couldn't have done it. And then I enjoyed the challenge of undertaking and completing first my diploma and then my MSc at Keele, and was very well supported by the academic and administrative staff. Another thing that we offer you is that very few of our courses contain compulsory elements, and we offer the option for you to choose the modules that best suit your own particular learning needs and to build up your own pathway to a postgraduate award. And on our new website, CPD4ALL.co.uk, we've developed a course builder which shows you the range of modules that you can choose from and enables you to start building up your own pathway to an award. So I would encourage you to have a look at that to see how you can build up your own bespoke award. So whatever stage you are in your career, we have something to offer you. If you're a pre-registration student, we offer MUR accreditation, and this will give you 5 academic credits which you can then use towards a postgraduate award once you've qualified. For those in the early days of practice, we offer postgraduate certificates and diplomas in areas relevant to your practice. Once you've completed a diploma, you could go on and study for an MSc. And for those with more experience, we offer courses around advanced practice, and in particular we offer the highest level of academic achievement, a professional doctorate. So our programmes. We have programmes that cover most areas of pharmacy practice. So our clinical pharmacy programme aimed at pharmacists working within hospital practice, community pharmacy programme, our prescribing studies programme for pharmacists working in primary care and with GPs. We provide an independent prescribing course. We have an advanced professional practice programme and a portfolio of modules within that. And as I mentioned before, our professional doctorate in pharmacy. So we're going to talk a little bit now about the more specific details of our courses, just to give you an overview. So if you're in your early career, for an early career pharmacist, you'd be looking at perhaps completing a postgraduate certificate or a diploma. We do, as I said, offer our practice certificate in independent prescribing, and this is for pharmacists working in all sectors of pharmacy, but you do need to be 2 years post-qualified to be able to undertake the practice certificate in independent prescribing. And of course, all of our modules are available as short courses and can be studied just as a short course. So I'm going to just hand over to Daxa now to talk a little bit about the programme that we offer for hospital pharmacists.
Hello everyone, I'm just going to talk you very briefly through our clinical diploma. The aim of our clinical diploma is to equip hospital pharmacists with the knowledge and skills and the confidence to develop their clinical and professional role. There are essentially 2 pathways. The one is a fixed pathway route which starts in January, and the other route is a flexible route, which you can start at any time point that suits yourself. The course is distance learning, as the majority of our courses, and all the learning materials are actually provided for you. There is very minimal attendance at Keele or Birmingham, and that is just to present a case presentation as part of one of your assessments. We have 20 modules that you can choose from, and you study 6 for the certificate year and a further 6 for the diploma year. The 20 modules gives you a lot of choice and flexibility, so no matter which route you take, you can study at your own pace. There are some modules that cover the core clinical pharmacy skills, like evidence-based practice and monitoring therapy, and there are others that focus on therapeutic areas such as cardiovascular disease, gastrointestinal disease, and more specialist areas like critical care and HIV. Our assessments very much encourage deeper learning and is very much based around a work-based experience, your workplace. The assessments include problem-solving questions and care plans and case presentations and audits. All our modules and the programme is linked to the RPS faculty framework, so you can link this to your own professional development. So if you would like to find out more about the clinical diploma, please join us on our webinar on the 18th of June. Thank you.
Thank you, Daxa. Sharon, would you like to talk a little bit about our community pharmacy programme?
Okay, so I'll just briefly talk you through our programme. So the community pharmacy programme aims to provide a wider view of healthcare and equip community pharmacists with sufficient skills, knowledge and confidence to enable them to extend their clinical and professional role within the healthcare team, helping them achieve the challenges set by the NHS 5-year forward view for the profession. Again, the programme is highly flexible and distance learning and allows pharmacists to start their certificate or diploma at a point within the year to suit their personal circumstances. It also enables them to study where and when it is most convenient for them. The programme allows pharmacists to choose their own pathway to a community pharmacy award from our wide portfolio of modules, therefore allowing them to tailor their diploma around their personal learning needs. We offer a wide range of therapeutic modules such as heart failure, asthma and COPD, as well as modules to support their role in the community, such as developing and delivering high quality services and working with prescribers in primary care. Students have 6 months to complete each CPD Plus module, however you can submit sooner if you wish. You have to complete your diploma within 5 years of starting, and there's nothing to stop you completing your diploma within 2 years if you wish to do so. Also, there's the option if you want to just to complete a standalone module just to fulfil your CPD needs. If you would like to, you can integrate the independent prescribing course into the community diploma to be awarded a diploma in community pharmacy with brackets independent prescriber. And also there's the option to continue beyond the diploma award to complete the master's year.
Thank you, Sharon. Jackie, would you like to tell us a bit about the Prescribing Studies programme and our independent prescribing course?
I certainly will, just show my face. Hello again, yes, so Prescribing Studies programme, it's been designed to meet the needs of those who work in primary care, for example those who may be directly employed in a GP practice, or those who have the role of a prescribing advisor. For example, they may be providing prescribing advice within a CCG. The Prescribing Course Studies programme is also open to other healthcare professionals, including medics and nurses, but the majority of our students are pharmacists. Like the community programme, the Prescribing Studies takes on a very flexible route, and it is all delivered by distance learning. You can choose modules from 3 themes, so we have principles underlying rational prescribing, practical considerations for the prescriber, and prescribing in key therapeutic areas. So this may mean that you may choose modules such as rational prescribing or patient-prescriber partnerships, or you may be more interested in monitoring drug treatment or hazards of drug use. And the key therapeutic areas, quite wide, cover things like asthma, COPD, hypertension, angina, heart failure, all of the key areas, and particularly focusing on long-term conditions. Again, similar to the community programme, all the modules may be studied individually for your own CPD needs, or you can build up a pathway which will lead you to a certificate or diploma award. If you want to have a look at the full range of modules that are available, then the website is listed on this slide. And again, like the community programme, the independent prescribing programme can be included within your diploma award. Let's move on to talk about independent prescribing. Whoops. Right. So the independent prescribing course is a 60 credit course. The course at Keele is designed specifically for pharmacists, and it's designed to meet the GPHC learning outcomes to enable you to register as an independent prescriber. So it does give you the certificate for your professional registration with the GPHC, but as it's 60 credit, you also get awarded 60 academic credits, which you can use towards any of our postgraduate diploma programs, or even within the MSc. So the independent prescribing course, to meet the GPHC requirements, does require 6 days attendance at the university, and that is normally 1 day a month over a 6-month period. You also have to complete 12 days supervised learning and practice with your designated medical practitioner. So we will ask you on application to find a medical mentor who can support you for this 12 days of practice. And they are a key person in helping you to attain clinical skills and to build up your knowledge around consultation. The rest of the time is guided and open and distance learning. We provide you with a lot of materials to support your learning. And at the end of the course, you will have developed and compiled a full reflective portfolio which details evidence of how you have met the GPHC learning outcomes, as well as the prescribing competencies that are required for this course. But if you do want to find out more about the independent prescribing programme, please join our webinar, A Prescription for Pharmacists, which we're holding on the 18th of May. Thank you.
Thank you, Jackie. So we'll move on now to talk about what we offer for those of you who are perhaps a little bit further on in your career, who perhaps already have a certificate or a diploma award. So we do offer a professional MSc Year, and we have our advanced professional practice programme and our professional doctorate. So the professional MSc Year, you must have completed a postgraduate diploma to be able to join our professional MSc Year. It's a little bit different from perhaps a traditional MSc, which is entirely which is a 60 credit research project and the production of a thesis, in that it's focused on your practice. And the first module is a portfolio-based module to enable you to really focus on a particular area of your practice and develop your skills and expertise in that area. And that will be the area that you then go on to complete a small research project or service evaluation in. So we use the Advanced Pharmacy Framework, and your portfolio module will be linked to the Advanced Pharmacy Framework. There's also a research methods module, and then, as I've said, the research project. And that's a 1-year course, but you must have completed a diploma. We have an advanced professional practice programme, which supports development through the use of the Advanced Pharmacy Framework. There are some portfolio-based advanced practice modules within this. There are modules around leadership and management, communication, working with GPs, education, research. You can also incorporate the independent prescribing course into an advanced professional practice diploma. And very topically at the moment, if you're interested in developing your skills to work with GPs and work more closely with prescribers, you might want to consider looking at our advanced professional practice modules and building up a diploma to support you in that role. This could include the independent prescribing course, a module around working with prescribers in primary care, a module called Building Working Relationships, which covers leadership skills and developing those team working and leadership skills that you need to work in GP practices. And then a portfolio-based module to really develop your specialist area. We also have a new program that we're developing in September 2015 around pharmaceutical drug development, and I'm going to just hand over to Alison to talk about that.
Thank you. Yes, the Pharmaceutical Drug Development and Business Management course is a specific pathway on the Advanced Professional Practice programme, and it's new for September 2015, so our first cohort will start then. The course takes a total of 3 years in order to be awarded a master's, but you've got the option of gaining a certificate after year 1 or a diploma after 2 years of study. The course is designed to provide an overview of the pharmaceutical industry, and this is all the way from the initial development of a new chemical compound right through to the marketing of a licensed drug internationally on a global market. So the course includes modules that also cover financial and business management, marketing, and issues around business strategy and the global market for pharmaceutical products. We have a team of expert tutors who have significant experience in the pharma industry, and they have actually written the course for us, and they will continue to support the students as they study. So there are very knowledgeable people involved in ensuring that this is a very relevant course. It's a wholly distance learning course. There are no attendance requirements for the course, and so students can study very flexibly and obviously in a number of locations. You're supported throughout the course by our online materials, and that will include podcasts and webinars to actually encourage interaction. It's a suitable course for those who are interested in working in the pharmaceutical industry, and also for those who are very early in their career in the industry and want to know more about the pharmaceutical industry as a whole and the different areas. For entry on the course, we recommend that students have a science background, because there is a good science component to certainly the first year of the course. And as the course is part of our CPD Plus programme, you can also study individual modules and incorporate them into other courses rather than having to take the course as a whole. So there's a great deal of flexibility within the course.
Thank you, Alison. Do you want to talk about the professional doctorate in pharmacy now?
Yes, thank you, Lizzie. The professional doctorate is obviously a doctorate level study, and it's about developing your knowledge and research skills to further advance your professional practice. So it is very much related to practice. The subject area that you study will be specifically chosen by you to be relevant to your professional practice. The study is part-time, and the research is undertaken within your workplace so that it is truly relevant to what you're doing. The professional doctorate differs to a PhD in a number of ways, but one of the important things that is of great benefit to students is that you join a cohort of students who actually therefore will provide support and encouragement for you as you go through the course, and that's a very valuable thing compared to perhaps the rather more individual learning experience that a PhD can provide. So the course will help you develop both advanced research skills and knowledge, but in addition to that you also develop knowledge and skills on a range of wider professional issues, and they include leadership, issues around management, around working with others including mentoring, around educational skills, and also other related professional skills. So it's a quite wide encompassing course and really prepares you for very advanced level practice. If you'd like more details about our doctorate and how you could join us on the doctoral study programme, then please do join us. We've got a webinar on the 9th of June when we'll go into this in much more detail.
Thank you, Alison. So we hope we've given you a brief overview of what we do and whetted your appetite to find out more. We do have a series of webinars running over the next 2 months, and they will all be advertised on our website, in the events section of our website. But the next one is around pharmacists working with GPs and how we can support you to work with your GPs, and that is on Wednesday, the 13th of May. That's next Wednesday, and that will be at 7:30 p.m. So we do hope you'll join us then. Thank you. Does anybody have any questions? If you'd like to ask questions, please do post them in the chat box. We've got a question being typed. Just while we're waiting for the question to come through, please again don't forget to use our hashtag if you're tweeting about us and about what we do. So, question: how does the course work when I'm at work? How does the course work when I'm at work and may not be able to attend a live session like this? That's a very good question, Luke. Thank you for raising it. All of the materials are provided online. If we're doing live sessions like this, they will be timetabled in, so you will know well in advance when they are. There's not many per course, and sometimes we will actually timetable them in the evenings to make sure that students can attend. Or I think for our community pharmacy course, we also timetable them in at the weekends as well. So we're flexible about when we do live events like this. However, the majority of the learning is actually provided online, in written form online or through podcasts online, so that you can study them wherever and whenever you want to. I hope that answers your question. Thank you. Yes, it does. Okay, are there any more questions before we finish this webinar? Okay, well, thank you. Oh, one more. Just wait for the question to come through. How many course combinations do you offer and why? I'm not sure I can actually put a number on how many course combinations that we offer, Luke, because you can build up your own pathway to an award. So we have over 200 modules that you can choose from. Certain modules are more designed for people working in particular areas of practice. So we have modules that are written for pharmacists working in hospital practice, which if you're not working in hospital practice, for example, would be quite difficult for you to study. But conversely, we have modules for people working in community pharmacy and prescribing studies. So you can choose modules that are suitable to your area of practice, and pretty much build them up into as many different combinations as you like in order to suit your own individual learning needs. So we do have the course builder on our website, which will allow you to start building up a bit of a pathway, and you can send that then across to us and have a chat with one of us to help you to build up your own bespoke pathway to an award. So how many combinations? I think I'd have to do the maths on that one, but a lot. But really the emphasis is that you can build up an award that suits your own particular learning needs for the area of practice and the stage of your career that you were at. Great, thank you. Okay, do we have any more questions? No, well, thank you very much, everybody, for joining us. We will post this onto our website, so if you missed something or want to go back and listen to it again, you'll be able to do that. So, thank you very much.